I'm Todd Neal with MedPage Today in Amsterdam. A randomized trial presented here looked at the cost-effectiveness of using CT coronary angiography in the evaluation of patients presenting to outpatient clinics with chest pain. I spoke with Dr. A.J. Yaramasu of Wellington Hospital in London about the study.
Obviously, there's been a lot of interest recently on the role of cardiac CT, especially CT angiography in investigating patients with chest pain. There have been a lot of trials in the US, especially in the setting of emergency department. We in the UK wanted to look at the stable chest pain population, which is why I set up this radical trial to look at the cost and clinical effectiveness of CT in this population.
The radical trial, which is still collecting outcome data, is a prospective trial conducted at 4 hospitals in London that involved nearly 600 patients.
This is a randomized control trial, so we did one-to-one randomization. The control patients had the standard of care and the study arm patients had a CT upfront, and their management was dictated by the findings of CT angiogram. The main findings are CT can drive the costs of diagnosis down in this patient population without compromising their clinical outcomes. And one of the important findings is CT can be performed at a similar radiation dose as the conventional angiogram. That has been the biggest worry among physicians as well as patients with regards to CT.
Although the final data were not available, Yaramasu said that initial calculations showed that there is no difference between the groups in rates of revascularization or major adverse cardiovascular events.
The takeaway message is CT coronary angiogram can be performed in this patient population with stable chest pain or similar symptoms suspected due to be heart disease. It will reduce the cost of diagnosis in this patient population, and patients who had a negative CT, which is a normal artery or non-obstructive coronary disease, can be discharged safely without compromising their clinical outcomes.
From Amsterdam, I'm Todd Neal, MedPage Today.